I want to welcome you all to our Community Our Health. It's a national town hall meeting to share our ideas about health and prevention and treatments that impact our communities. Today's event is going to be focused on COVID-19, vaccines, and new treatments. My name is Linda Cottler. I'm an epidemiologist. I'm the Associate Dean for Research here at the University of Florida, and I'm the Director of Health Street, our community engagement program. I want to welcome our health panelists here, and I want to start with Dr. Nicole Iovine.
Hi, everyone. Thank you so much for having me. I am an infectious disease specialist, and I am also the Chief Hospital Epidemiologist here at UF Health.
Thank you. Dr. Kartik Cherabuddi.
Hi, everyone. I'm an infectious disease specialist as well, and I help the university with helping manage antibiotic and vaccine policies. Good to be here.
Dr. Marie-Carmelle Elie.
Hello, everyone. I am an associate professor here at the University of Florida, and I practice in emergency medicine, critical care medicine, and hospice and palliative medicine.
Thank you. Dr. Michael Gutter.
Hi, thank you. My name is Mike Gutter. I'm Associate Dean for Cooperative Extension here at the University of Florida IFAS, and I work with our faculty who focus on youth programming, health and economics programming, and community programming all across the state. Thank you.
Thank you. And Dr. Dwayne Mitchell.
Good afternoon. I'm Dwayne Mitchell. I'm a professor in the Department of Neurosurgery, and I direct our Clinical and Translational Science Institute. We're focused on helping improve health through clinical research, clinical trials, and community engagement.
Thank you so much. And I want to thank B. Lynch, who has organized this town hall meeting. So thank you, B. Our Community Our Health is conducted by the University of Florida's Health Street program, which is in the Department of Epidemiology in the College of Medicine and the College of Public Health and Health Professions. And we're funded by the University of Florida's Clinical and Translational Science Institute. Now, for you to become engaged in Our Community Our Health event today, just go to the bottom of your screen and click on the Q&A and ask whatever questions that you have. Anything you want to ask us, we would like to be able to answer for you. So please don't be shy. We really appreciate the opportunity to hear your thoughts and to share some of this information with you. So I am going to share my screen and hope you can see it. Can you see my screen here?
Yeah.
Yes, okay, great. So what is going on? Well, first, again, we have greetings from Florida. What's going on is this pandemic, and this globally around the world, there are over 104 million, almost 105 million cases of COVID-19. And in terms of deaths, there are 2.28 million deaths. And in both cases, the United States leads this with almost 27 million cases in the United States and over 455,000 deaths. These are the rankings of the states by cases, and they go according to how populous the state is. So California has the most cases, followed by Texas, followed by Florida. And you can also see the deaths here from COVID-19. I want to share with you briefly some of the information on risks for hospitalization and death. These are from the CDC. This graph shows you the hospitalizations compared to people who are 18 to 29 years of age. So as you age, your risk for hospitalization from COVID increases. As you age also, compared to those 18 to 29, your risk of death increases. So for example, if you are 40 to 49 years of age, you have over 3 times the likelihood of hospitalization compared to someone 18 to 29 years of age, and over 10 times higher risk of death compared to someone who is 18 to 29 years of age. In terms of cases and hospitalization and death by race ethnicity, you can see a higher rate of case infection by race compared to someone who's white, and hospitalizations are increased. And when you look at the death rate, it is really higher in those who are Black or African American compared to those who are white. They have they have 2 times the likelihood of death. There are also other factors that can also increase community spread and hospitalization, and these show the risks increasing by the different kinds of condition that you might have. So if you have diabetes, you are 3 times more likely to be hospitalized from COVID compared to someone without diabetes. And you can also see if you have 2 conditions or 3 or more, you can see how your risk increases. And these risks are really due to things like social determinants of health, like if you have access to care, if you have increased exposure because of your job, because of your living conditions, etc. So where we are right now, we are in a pandemic over an epidemic, and these epidemics are just more highlighted now than ever. We have epidemics of hypertension and diabetes and stroke and drug overdose, mental health depression, food insecurity, racism, unemployment, and an epidemic of misinformation. So today, we are going to have a dialogue with you. We want to answer your questions. We want to discuss the vaccine and the treatments and discuss the misperceptions. I want to again thank Health Street. I want to thank the Clinical and Translational Science Institute. I want to thank IFAS, UF Health, and the University of Florida. So next, I am going to turn to my colleague, Dr. Michael Gutter, who's going to talk about some of the things that he's hearing from talking to his community constituents. Dr. Gutter, thank you for joining us.
I want to thank you very much. And again, thank you so much to Health Street for providing this. And we're going to jump into some questions here in just a moment, but I wanted to just paint the picture of why these types of conversations are so important. And I'm really grateful that so many of you are tuning in today to join us to hear from our experts here at UF Health. There's so many misperceptions and concerns that are out there around the virus, around the vaccine. And in doing some word cloud communities or word cloud activities with community educators, this is just some of the types of comments that people are giving us, just to show you a visual of all of the different concerns, all of the different things that people think. And what's one of the biggest things that our audience told us in this word cloud? And for those of you who aren't familiar with word clouds, the ones in the middle that are really big are the things that are the really common emphasis points people are giving us. And so misinformation, there's misinformation, there's safety, there's health, there's hope. There's so many things out there. There's so many challenges. We look at challenging, we look at quick development, right? Which is certainly a concern a lot of people have had. And what does that mean? So many questions that we raise because we don't all understand it. And you know, I tell everybody I have a background in economics, and so I learn a lot just by asking the questions. And today we have some wonderful people here who are going to answer some of these questions for us. And I'd like to, if it's okay with you all, move into some of the questions that we have outstanding for our guests today, if that's all right with you, Dr. Cottler.
Absolutely.
Well, this is great. And I'm really grateful that we have quite a few people here. So we won't necessarily assign some of these questions, but we will just kind of start and invite our 3 experts here to share some of their opinions about these ideas. And we'd like to start with a few easy ones, if we could, please. And the first is, and this still comes back to testing, so we'll start there because we really wanted to focus our first segment on vaccines and testing, if we could. How often do I need to get tested?
Hi, this is Dr. Nicole Iovine. So getting tested for the coronavirus depends on some things that might be particular to certain groups. So First and foremost, if you have symptoms of an upper respiratory infection, cough, sore throat, runny nose, headache, fever, you definitely need to get tested for the coronavirus. There are some people who take care of others at home who are in the high-risk groups for severe disease from coronavirus. So you might be taking care of someone, for example, who has cancer and is getting chemotherapy, or maybe you're taking care of your elderly parents, for example. So it's especially important for you then to make sure that you're not infected with the coronavirus. So again, if you're having even very mild symptoms that you might think, oh, that's just my allergies, you should really make sure that you get tested. So especially if you're taking care of really vulnerable people.
A follow-up to that, if I could, and again, for anyone here, where can someone get tested? Where can I do that?
Sure. So the Department of Health does coronavirus testing, absolutely. So your local health department can do that. Many private physicians in their offices can offer testing as well. And also, for example, at UF Health, we are able to do COVID testing in our own hospital, actually. So there's actually a lot of different ways that you can get it done. I might be forgetting some other opportunities, but those are some big ones.
Dr. Iovine, there is a question that says, you know, there are different, every state has their own accessibility for getting tested. And some people who live in states where they're really, really bad really don't seem to know how they can ever find out how to get tested. What would you tell them to do? How can they even get on a list, or how can they find out?
Yeah, so for getting tested, so that's a good point. You know, there is different levels of access that people have to the test. In some states, you can get tested at a local pharmacy. So I would encourage you to ask at your local pharmacy if the testing is being offered. That would probably be more convenient than necessarily driving to a Department of Health site, which might not be anywhere near you. But in addition to that, I would also encourage you to speak with your own physician about what is available to you. But also many urgent care centers also are offering testing as well. So I would explore your local pharmacies, your urgent care centers, and your providers as well.
Thank you. We have a few more questions related to tests, and then quite a few on the vaccine. Let's maybe finish, take some more of these test questions first. And this is, how fast are the tests typically? And I know there's different tests available, so perhaps it's a multiple choice answer.
Yes, those are the best kinds of ones. So there are some tests that are can be done right there while you're seeing the healthcare provider. So you get the answer back in just a few minutes. There are other tests that have to get sent off to a laboratory, and those might have a turnaround time of 24 to 48 hours. In general, the turnaround time for getting your test result has gone down tremendously. Early in the pandemic, it was 3 to 5 days, but now it's in general 24, maybe 48 hours, except for the ones that are done right in front of you.
And one more as well related to this too. You know, I know some people are tempted to get tested regularly for the peace of mind factor for it. Are these tests free? Are they all free? Do insurance companies set limits on the amount of coronavirus tests someone can take that we know of?
Right. That's a very good question. You know, it depends. You know, if you have signs of illness, and if you have medical insurance in general, those tests are covered. It's harder, though, to have coverage when you don't have any symptoms. And again, different states, different counties even have different criteria for whether or not they will test you if you do not have symptoms. It may also depend on whether or not you've had a significant exposure to somebody who has had COVID as well. So it is kind of a hodgepodge of, you know, whether or not the tests can be covered by insurance or not. And also, let me just go back. And again, also some, in some locations, you can get testing for free as well. But again, it's a very mixed bag.
Absolutely. We did have kind of a segue question sort of in between, and this is, you know, on the importance of testing, which I think we discussed well. Is it important if someone's been getting tested, is testing still necessary after one has potentially received their second dose of the vaccine? Should regular testing still be a pattern? Is it still necessary? Or, you know, a lot of people aren't sure what that necessarily means, and certainly that'll lead us to vaccines.
That's a great question. And again, just to backtrack a little bit, you know, getting tested regularly, you know, is still leaves open the possibility that in between your tests, you could be infected and you could transmit the infection. I would suggest a strategy of really adhering to mask wearing, hand hygiene, social distancing, and avoiding large gatherings as really your best strategy. I'm sorry, what was the question I was supposed to answer? I already forgot.
Oh, just so if someone has then been able to receive their vaccine doses, how important is testing afterwards, even if,
Yes.
So if shed some light on that, please.
Yes, yes. So the vaccines are very effective in preventing you from getting sick with COVID, but nothing's 100%. So if you've been fully vaccinated, but you develop signs and symptoms, fever, sore throat, headache, you could even have intestinal symptoms as well. If you have symptoms that are consistent with potentially having COVID, you should still be tested because nothing's 100%.
So Dr. Iovine or Dr. Elie, there is a question about people who won't get the vaccine. They just don't want to do it. And I just read something myself this morning about how 38% of people who work at nursing homes will not be tested right now. Can you just shed some light on this, this hesitancy that people might have? Are they the same people who might be hesitant about the flu shot or that? And also, what do you say to somebody who tells you they don't want to be tested?
Well,
Not tested, I'm sorry, who don't want the vaccine. Sorry, they don't want the vaccine. What can you say to somebody to both allay their fears, but also what can you say?
So there's a lot of reasons why the fear exists, and it's justifiable. I think the history of vaccines and new treatments in our society and in the medical community has not necessarily been without a lot of concern. In particular, I think that in the African American community, I'll speak to that very specifically. We know that a fraction of them are being vaccinated compared to their Caucasian or white cohort. And yet, as you had discussed a little earlier, the risks of complications, hospitalizations, and death are significantly higher. And so when we think about that, I think we have to perhaps reflect back on the reasons why these fears exist. And those include the fact that perhaps there has been experimentation done in certain groups that would remind us of this, the patients that perhaps are in those groups with issues of social determinants of health, certain racial backgrounds. But in addition to that, the other reasons is because in years past, we've not done a great job of making sure that we've included a very diverse population when we have been studying these medications. What I'd like to reassure people about is that this is front and center part of what we're looking at as investigators, as scientists, as we are designing these treatments and defining the best therapies for all patients. And we're making sure that we're including populations of diverse background, both Black, Hispanic, and white. All those populations are being included in these studies to ensure that the therapies and the outcomes are actually applicable to everyone, and to the extent that we can. But it's an important statement to make in light of the history of vaccines and other therapies that we've been using in the community. Other things to think about are just reflecting on the community that's at greatest risk. So we talked about the elderly community as well. I'd like to just perhaps share something that was shared to me by a patient that I recently saw in the emergency department, who was able to get her vaccine after waiting for several weeks. But she was in her late 70s, and she was raised during the era of the polio vaccine. And she remembered losing friends in school. And losing family members and having those that had succumbed to polio. And ultimately, there was a huge push to ensuring that every woman, man, child was vaccinated in the community. And she said, well, if that hadn't happened, polio would not have been eradicated. And the reality is that there is a population of the most vulnerable that actually went through a very rigorous campaign to protect future generations and the most vulnerable generations and populations from getting ill. And in many ways, this is perhaps our duty and our opportunity to do the same for the population that's most vulnerable and perhaps cannot get access to the vaccines now.
Very, very important information that you just shared, Dr. Elie. Thank you so much. There's a question here. What's being done to increase vaccine accessibility for individuals who cannot travel? What's being done for them? They may not have access to, or they may not have transportation. They may not be able to even get their appointment because they don't have internet, not just because they can't travel, but what are some of the logistical barriers that we can remove?
Well, I can speak very specifically to what I have seen in our communities here in North Central Florida. One of the major barriers is that some of our communities indeed do have barriers to transport or are homebound. And so many of our nursing facilities that have had access to the vaccine have worked with their local communities in order to extend the vaccine to members of their community. And the departments of health have been working with these nursing facilities that are local to people's homes in order to extend that vaccine. I haven't seen any campaigns as yet to get into people's homes, but there are many facilities and hospitals that are creating outreach programs in order to assist with those that don't necessarily have ready access or have difficulty identifying appointments.
Yeah, Dr. Gutter.
I just wanted to add too, and I know in some of our rural communities that, there's just a lot of partnerships being formed, people trying to collaborate to find appropriate venues for those types of sites. I know some of our facilities near Cooperative Extension or fairgrounds are being used. So, as we look at these, getting them out there is one of the challenges, and making sure, as we know, not every rural community, for example, will have all of the medical facilities there. The cold chain logistics required for the Pfizer vaccine, for example, things like that can just pose additional complications or barriers for it there too. So I know there's community partnerships, and there's many working hard, I would say, to try and improve the situation as time goes. If I could, I would love to pick up on this logistics theme with a follow-up question that came in, and this is, I don't know who might want to take this, but maybe Carmel, Elie, or others too, if you're interested in this. But What did you learn about the logistical requirements to prepare for large-scale testing drives? This is, as we're kind of a long time into this there and thinking of lessons learned, are there things, and not necessarily things we would have done differently, or, not everything was our decisions here, but are there things that we would look to trying to do going forward, should, heaven forbid, something like this arise again that's new to us? Any thoughts on that from our panelists?
Yeah, I mean, I'm just thinking, gosh, so much has been done. I know one of the issues, and you kind of alluded to this earlier, is how do we reach the right people? And we're very electronic driven, and one of the ways we communicate at UF with our patients is through an electronic application. But of course, not everybody, has that. And so, that brings into, the issue of, how do we reach out to people who are not, texting every 2 seconds, or, constantly on their phones, checking for updates on things. So it is a real challenge, and it personally pains me to think that, we're missing out on some important parts of the population because of our reliance on electronic methods. I don't know if Dr. Cherabuddi has some more comments on this.
Yeah, we've tried to reach people in multiple ways to offer testing. Nicole, as Dr. Iovine mentioned, it's spreading the word, even in communities, door to door, making it as easy as possible, making sure we take away some steps. So we've finally offered saliva testing and let people get tested who are not UF patients. They can come by and get tested as well. We worked with the health departments and making sure we can partner with them and make these testing available through the health department as well. So saliva testing makes it easier. We also use our steps in the testing better. We've produced test equipment right here at UF. So multiple things to make it available to the community.
Mm-hmm. Okay, there's a few more questions about the vaccine. One of them is about why does the Pfizer have 2 to 3 weeks and the Moderna has 4 weeks? And why would the new one only have 1 shot? And what's better?
I could perhaps address some of that. So as many people probably are aware, there have been a number of companies working very frantically over the last year with a lot of resources put behind developing and testing the safety and the effectiveness of these vaccines. That there are actually over 100 different vaccines of COVID that have been under development. The Moderna and the Pfizer vaccine, as people are aware, are the first 2 that have reached approval. And each vaccine has essentially the same goal of trying to boost a person's immune response against the virus, so that if you encounter the virus out in the community, your body already has immunity against it and can immediately go to fight the virus and prevent it from taking hold and certainly causing a severe infection, and ideally preventing it from really being able to get a hold and establish an infection altogether. The different vaccines and the different approaches, the good thing is that each of these strategies are taking a slightly different approach to testing how to combat the virus. And because of those differences, the schedule of which they are been tested and given, whether it's a single dose or 2 doses, is really tied to how those vaccines have been developed. And oftentimes, even before they end up in clinical trials, they're being tested in a laboratory setting, or what we call a preclinical setting. And so much of what they learn about how the vaccine is likely to work then plays a role in how it is scheduled and administered to patients. And so I think we'll see, as there are more approvals for vaccines coming online against COVID, one, it's useful to have many different options and many approaches, but they will likely have these very specific differences that are tied to how they were developed and how they actually work to combat the virus.
Dr. Mitchell, or others too, we have quite a few questions that go into that a little bit more. These vaccines were certainly developed quickly compared to what some of us remember from high school biology and things like that in terms of how it might work. Can one of you all perhaps explain how was the vaccine developed so quickly? Does that interfere with its safety? Should we have concerns about that? A lot of just different types of questions that really kind of relate to that there, just in terms of how it can be done quickly, how is it developed, and how do we know it's safe if it's only been around for so long? So not sure who would like that, or if all of you would like to chime in.
I could do a little bit on that and then turn to others. So these are great questions, and I think there's probably two really important factors. There are many, but two I think really important factors to keep in mind with the vaccine effort. One was that while these vaccines against COVID-19 were developed very rapidly, the research and the platforms that these vaccines are using have been under development for many, many, many years. In fact, one of the, if you look at the Moderna vaccine and the Pfizer vaccine, they're a new type of vaccine formulation called mRNA. It's basically a different way of presenting to the immune system the parts of the virus that you can likely attack and recognize. That approach for vaccine development has been explored for many, many years. In fact, our own research in our here at University of Florida and many of the investigators within our program have been looking at that type of vaccine as potential therapies for cancer, for other infectious disease approaches. So the underlying approach has been under development for many, many years. In our own group, I know for over a decade. And so what the people were able to do is when the information was shared about the specific virus that was causing COVID-19 infection, they could use the information about the virus and the years of development on bringing this technology forward to very rapidly focus on then using that information to develop these vaccine strategies. So they were brought forward with a lot of concentrated resources, a lot of money was put towards it, a concerted effort to really focus on it. And then each of these companies have actually been using vaccine approaches that have either been in development for many, many years or have actually already been tested against other infectious diseases and now are turned to focus on COVID-19. So it is still very impressive that the resources were able to be concentrated and focused in this area. But I think people should know that it was built on really, in many cases, decades of actual information expertise and even safety and evaluation in patients.
I would add also that no steps were skipped at all in the process of the studies and in the oversight and in the safety analyses. Every single step that's normally done was followed. And as Dr. Mitchell mentioned, it's just because of the unprecedented focus and effort and quite frankly, money that was put towards this urgent need that the vaccines were able to come to market as quickly as they did.
Can you talk a little bit about the scheduling difficulties? Why is it so difficult to schedule for a vaccine?
Well, I mean, there's a supply and demand issue right now, that's for sure. So, you know, there are more people who want the vaccine than doses that we have in hand. So that's kind of the first big problem. And, you know, so for all the other, there are many people we want to vaccinate everybody, but we simply don't have the doses right now. So that right there is the rate limiting step.
Dr. Cherabuddi, can you, expand on that a little bit about the vials or what?
Yeah, and essentially to expand on what Dr. Iovine said, we're getting a set number of vials, right? And we want to make sure we give those vials. Each one has either 5 to 6 doses or 10 doses, depending on the kind of vaccine we're using. And we want to make sure we see the doses, we know how many we have, and then we schedule the people to get those vaccines. If we schedule more people than we have vials, then people are going to be unhappy. But if less people turn up, then we open the vials for that day, because these vaccines do require a cold chain. You might be ending up wasting vaccine. So it's this really close planning that's required to make sure how many people come in. The bigger player is getting in the number of vaccines. So the supply demand in a global scale throughout the country is very important. And then locally to make sure you're planning it out each day. And that plays a big role as well. You certainly don't want to waste any doses when we have a fewer number of vaccines to give out.
Just a really brief one that I think you could answer would be, can I get my shot in the same arm as before, or do I need to switch my arm? And what are the symptoms that I should look out for?
You can do it in the same arm, definitely. The sorts of reactions that we're seeing after getting the vaccine, in large part, are similar to what you might get after any vaccine. You know, a sore arm is the most common thing that occurs. Some people might have other reactions, like they may not feel well afterwards, like as if they have like a cold or even a flu. They may get a headache. So a fewer number of people might develop a fever. But I would remind everybody that when you get all of those reactions that I mentioned, that is occurring because your immune system is getting revved up by the vaccine, appropriately revved up, and is responding and making the immune response, making the antibodies that are needed. So if you have, those sorts of side effects, I know it's not fun, nobody likes it, but it is a sign that your immune system is doing what it's supposed to do. I think there was a question also earlier about which vaccine should I get? And the vaccine that you should get is the one that is available. Absolutely. There should be more vaccines coming to market from other pharmaceutical companies. And that's wonderful news because, again, our bottleneck is on having enough doses of vaccine. So the vaccine you should get is whichever one that you are able to get.
Dr. Gutter, before we move on, I just wanted to bring up one more thing, and that is that we heard, so age has its benefits in this case. We've heard that if you're older, the older that you are, that the less symptoms that you have. And so I just wanted to say that I think that that's pretty cool. I didn't have any symptoms at all from my first or second one, and maybe that's because age is a benefit in that case.
I don't know how much younger I am, but I did have some changes with the second dose, and it was fine. They completely went away. It was like a flu-like illness, and it all went away exactly at around 24 hours. It was just uncanny. I was feeling ill under a blanket, and then it was gone. You can tell that it's a flu infection doesn't end that way. It doesn't go away like that, but your immune system can get turned off that way. So that was incredible to even experience it as an infectious disease doctor, to go through that. So I would say get it. And for those of you who've had other vaccines, something I've heard from my own patients is that it sort of falls between the flu vaccine and the shingles vaccine. If you've had either of those, the side effects are sort of in between there. Mm-hmm. They're maybe slightly higher than the flu vaccine, but they're certainly lower than you get from the shingles vaccine.
Great, thank you.
Can I also just add very quickly, there was one question about what if you do not have major side effects from having a vaccine, or any side effects, and you shouldn't be concerned that if you have had a very smooth course with the vaccine, this has been a highly effective vaccination, and how much soreness or symptoms that you may or may not experience is not tied to the effectiveness of the vaccine.
Right. So
actually, more people don't have symptoms with the vaccine than those who have symptoms with the vaccine, including in the studies. So if you don't have any, good for you. You're in the majority there.
Dr. Gutter, would you like to move us to the next topic?
Yes, if I could. And please keep your questions coming. We're going to try and get to some of them, and we'll have some open Q&A time at the end. But we did want to talk about a few structured questions here too. And so Dr. Cherabuddi too, potentially, if you don't mind, while we're working hard to mask and use PPE and social distancing and getting vaccines rolled out, unfortunately, we know this is still a very infectious disease. People are still getting sick. are there treatments if someone gets sick with COVID? What are their options, sir?
We've taken care of hundreds of people who've infected with COVID through our clinics and in our hospital. We've certainly learned a lot. The treatments are different for those who are admitted with COVID to the hospital from those who are not admitted. Why is that, right? The treatments are sort of based on the stage of disease and how severe the disease is. So to look at these treatments sort of from those who get sickest to sort of those who are well is how I would like to discuss them. First, we use treatments that sort of decrease or turn down your immune system. We know that a lot of damage that the coronavirus does is because it makes your immune system go really high and maybe turned on too much later in the illness. And it happens only to a few people, but when it does happen, you get sicker. And in those patients, we use two kinds of treatments. One is a steroid treatment. Many of you may be familiar with them or have had taken them. These are used in those folks who require oxygen treatment to keep their oxygen levels up. In these folks, steroid use can prevent the need for getting on a ventilator or even death. Using steroids doesn't help in earlier stages if you don't require oxygen. I think that's an important treatment. Don't go out and try to get steroids if you're not in the hospital, not on oxygen. If you're on steroids for another reason, you shouldn't stop it just because you're infected with COVID. There's another treatment called Bosytinib. It's a little harder to say, and you might not be familiar with it, but it's a treatment that's been used in cancer therapy for quite a while. And Dr. Iovine and Dr. Elie have studied this as one of the sites for a national study, and works very similar to the steroids. Second, we have a treatment that kills the virus that is given through an IV. It is called remdesivir. It is used only in people admitted to the hospital with COVID. It gets you out of the hospital quicker, and in some cases prevents worsening of the disease. So those are our treatments for those admitted to the hospital. Next, for those who are not admitted to the hospital, to me, these are, if anything, more important, because if you take these treatments early, they could prevent you from getting sicker and prevent you from going to the emergency room or to the hospital to get admitted. And these are especially important that these be given early in the infection in those who are high risk for severe disease and death. And as Dr. Cottler showed, some of the groups that have the highest risk are the elderly. So this is a treatment that's out there. And the best evidence we have is for medications in this group that are antibody medications. They're also called monoclonal antibodies, but antibody medications. They're antibodies prepared to fight the little spike on the coronavirus. You've all probably seen the image. They have these little spikes on the top, and those spikes help the virus get into the cells. And these antibodies go and attack those spikes. Their names are a mouthful, unfortunately. They're hard to say. One is bamlanivimab. My daughter calls it Bam Bam, or you can call it Bamlan. The other is very similar. It's a mixture of two antibodies, and most people call it the Regeneron after the company that makes them. They're basically the same. There's not much of a difference. And I'll go over a few more details. But finally, we have Convalescent Plasma, which works similar to the antibody treatment medications. Here, plasma is taken from those recovered from COVID, and that is then used as treatment. I've often been asked how are they different. With antibody treatments, you get a fixed dose of a specific antibody that we talked about. With the plasma, you can have variable doses and probably different antibodies in the convalescent plasma. Both could work, but when I look at the evidence, that's certainly stronger that we have right now for antibody treatments. Question that's in there is how expensive are treatments? I'm just going to take on the questions. The antibody medication is paid for by the government. It shouldn't cost you anything. An administration charge can be placed, which is covered by your insurance. If you don't have insurance, it's paid through a COVID fund that the government has available. So you really shouldn't have to pay for the treatment itself or the administration. So it shouldn't cost you anything. Do you have to be hospitalized to get the treatment? Is question number 3. The antibody treatments are not given to those who are hospitalized. They actually should be used early in the disease before you need to get hospitalized. And they're either given through an infusion center. Some emergency rooms do, departments or rooms do provide them. So you have a mixture of infusion centers and emergency departments. And these infusion centers are where people get other therapies, such as for lupus or other rheumatic diseases or for cancers. Who has these treatments? Do we have them in Florida? We do have them in Florida. There are a number of places, including at UF. There's ones in Ocala and other places. How can you find them? A good place to find them is through the link. We're going to place that link in the chat now. You can even Google HHS or Health and Human Services and Therapy Locator. But review that link. You'll see areas close to you. You can have your physician or self-call the places to see how you can get them closer to you. We do have a number that can be called through your physician or through yourself, and we'll place that in the chat too. Thank you.
Thank you so much for sharing that. And, you know, it sounds like part of the questions we've had are, of course, helping us understand how to avoid getting COVID-19, prevent it both through vaccination and protection, and obviously around treatments too. We're going to turn now, Dr. Cottler, back to our Q&A. We've got a lot of outstanding questions here, and I don't know if there's any you wanted to start with, ma'am.
I wanted to start with a question about trust. There were issues, that were brought up before about how can we be more trustworthy, and how do we trust the science? And those are really important questions. And I just wanted to also put, just make a statement about our Clinical and Translational Science Institute here at the University of Florida, and also that they're in 63 other institutes around the country. And those institutes also have partner institutions and partners. So there are around this country, there are thousands of people who are working with their communities to link the community to the science and to the information. So this is one thing that you can do, is you can contact us. We'll give you our number. You contact us, we'll get you in touch, or you can go to the NIH, their website, and look up NIH COVID. We can, those are ways that you can really get involved and linked up to research and to science. But trust, we know when we talk to people in the community through Health Street, we know that there are people who have a low opinion of research and researchers, and there are others who have a very high opinion. And our job as scientists is to try to make sure that we are conveying the most important information to you, and that we can also do that through us. We can do that through our community health workers, and also through our extension agents, who are extension agents, as Dr. Gutter will tell you, they're in every single county, in every single state, and the territories. So there is a extension agent everywhere that you can speak to, and they can find ways to put you in touch with people who can answer some of your questions. So that was just a plug I wanted to put in, Dr. Gutter, and you can go on with the Q&A.
Well, thank you very much for that, and I appreciate that. And certainly, as we're all here, and you're seeing both from Dr. Cottler and I, and our experts here today, we are all here for you to educate and make sure that we demystify and make sure that we combat any of these. We have a lot of different questions here too. One of the things that's come up a few times has just been how are the vaccines that we understand right now addressing these new virus variants that we're hearing about? It's people are getting vaccinated and concerned, is it going to hold? Are there going to be boosters? Do we know anything about this yet in terms of effectiveness and efficacy on these new strains, or what's the latest?
So the evidence we have right now is it's evolving, I would say. So, I can't give you a number saying, well, it's this % effective against this variant and, you know, this % against this other one. However, the information that we have so far is that the vaccines will still give you protection against these variants. And in particular, information we have is that the vaccines are effective in preventing severe disease and death from these variants. So while it may be that in the future the vaccine might get tweaked to specifically cover whatever variants are predominating, the vaccines that we have right now are still what you should be getting, regardless of whether or not the variant is circulating in your area or not.
An additional question here too, for those patients who maybe have any number of conditions that might create immunocompromised situations for them, you know, potentially bone marrow, for example, transplant recipients or other challenges, what is a vaccine going to be effective? Is it safe for them to get? Are there different challenges for those who are already have an immunocompromised position or condition? Sorry.
It's really important that people that are immunocompromised get the vaccine. In fact, it's dangerous. It's much more dangerous to get COVID if you're immunocompromised, because we know that people who don't have great immune systems are at risk for severe disease and have a higher risk for death as well. So I would strongly encourage people who have immunocompromising conditions to get the vaccine as soon as you are eligible. The vaccine is not going to negatively affect your immune system. The vaccine is not going to make you more immunocompromised. It can't interact with your DNA. It can't be passed to future generations. It can only help you. So yes, immunocompromised people should get the vaccine.
That's actually very helpful. And I know we've talked about this a little before, you know, just the importance of maintaining PPE and, you know, the importance of this. Do you all have sort of a thought in terms of, is masking here to stay for the time being, in terms of that, you know, even as the vaccine continues to be rolled out? We have a long ways to go on that. Should people be used to masks for a little bit more of a long haul, that this is not going away anytime soon? We understand there's no crystal balls, but do you have any thoughts about that or recommendations perhaps?
Yeah, we're going to have to continue to mask at this point, and a couple of reasons. One is that while studies are being done, we don't yet know if a vaccinated person can still transmit the virus. So what that would mean is that, you know, you're immune to the virus. You're not going to get sick with it, but you could be carrying it, let's say, in your nose or in your throat. So that won't make you sick, but we don't know if you could pass that on to someone else. So that's why all of those, you know, the social distancing, the masking, all of that, you know, we do have to continue to do. The other reason also is that, you know, vaccines are fantastic, but they're not 100%. So, you know, there may still be people who are vaccinated, but still could develop an infection with COVID. It won't be many people, but you don't want to be that person for sure. So I think vaccines is going to be with us, not for the rest of our lives, but until we learn more, I think we should, you know, accept that we're going to have to continue.
Thank you so much. We want to take a few moments here to just do some audience polling and get some feedback from you all about this. I'm going to share my screen here briefly. We're going to ask you if you have a web browser handy. If you could please go to menti.com, open up any web browser and you should be able to go there, and you'll want to type in the code 4667895. This is going to be a chance for you to just tell us the words that come to mind when you think about the COVID-19 vaccine. What are some of the things that you've heard about today? What are some of the thoughts you've had? we're really curious to hear from you. So if you could take a moment to do that, and then we're going to switch over to one other poll, and you can enter in quite a few words if you'd like to. So if you have a chance, we'd love for you to take the time to do this. And what is fun is, as you'll see, we're going to get some live feedback of what we're all putting in here. So you can kind of watch some of our thoughts as we're coming in here based upon just conversations before today, after today.
This is so wonderful, Dr. Gutter. Thank you so much for doing this.
Well, absolutely. And we'll keep these in and we'll try and show them. I know we do need to move on here. We want to make sure we end on time. You can continue to enter these. I am just going to also share too that there is a second poll right after this one that just helps us to hear a little bit more feedback from you all. And I'll switch back to this one. But if you haven't already, and you want to click to the second screen, there we go. Just tell us how you felt about the following today. We're just curious for some of your feedback about this too for the presentation, so you can certainly look at those. Again, we'll take the time to do all of these. So as you can, we look forward to putting your feedback up here. We love hearing from you. I'm going to stop sharing my screen, but if there's time, Dr. Mitchell, I'll be glad to bring it up. Or sorry, Linda, did you want to?
Yeah, you put the number in the chat. So 4667895. You can do this later. You can do it Saturday if you'd like, but just write this number down: 4667895, and you can just Google Menti, and it'll come up with menti.com. So we would love to have your information.
We really appreciate it. And with that, I believe it is time for me to turn this back over to Dr. Mitchell for our closing, if I have that correct, sir.
Could I just make one quick comment, because we just didn't talk about children and vaccination, and just want people to know that the studies are being done to see about using these vaccines in children under the age of 16. So, we'll get there, but the studies are still ongoing.
All right, well, thank you so much. This really concludes our Community, Our Health Forum. I want to thank certainly our distinguished panelists, as well as hosts, for organizing this forum. Most importantly, to the participants for your engagement and your really thoughtful questions. We know there have been some that have been answered, obviously, during the discussion, others which we've typed back answers, and we will continue to collect that information and provide additional insights and resources for you. So I want to remind you that the UF Health is really here to be a partner with you, and this is an ongoing conversation as we all work together to get through this pandemic. We've posted some also links in the chat, if you're able to see them, that may be some useful resources to help follow up on some of the questions that even came up today. There are just 3 of them there. ufhealth.org actually has a community resource for information on the coronavirus. That is the first link there of coronavirus.ufhealth.org/resources. Also, the Health and Human Services has a community-based information. One of them was about testing sites. You can actually search by state for the registered COVID testing sites, and that link is there. And then below the posted Menti code link, there is a therapeutics distribution webpage where, again, if people want to know, where are monoclonal antibody treatments available for someone who may be at risk for significant COVID infection. Again, you can search that by zip code anywhere throughout the United States, and it will show you treatment centers within a 50-mile radius of that zip code that have at least received those monoclonal antibody treatments. Also, you can reach Health Street, which again is a community engagement forum for our Clinical and Translational Science Institute. And that number I'll post into the chat, but also read out loud as well, is 352-294-1111. 4880. So if you would like to, be included on any additional information, have suggestions for forums, or just want to know where you can be linked to resources that may help you or others in your community, please don't hesitate to call the Health Street number as well. And so with that, I think we will close out and thank everybody for their participation. I'll turn it back to Linda if any final comments.
I just want to thank you all again. We appreciate your thoughtful questions. Take care. Have a good weekend.
Thank you all.
Bye.